Yes, today I want to talk a little bit about the assessment and diagnostic formulation when it comes to case conceptualization and treatment planning. Assessment is really a prerequisite to developing a case conceptualization, and a comprehensive assessment is essential in developing a component and clinically useful concept conceptualizations. Assessments organize the content of the case conceptualization, and it focuses on treatment goals, clarifies expectations about what can and what needs to change, and it defines the client's and the clinician roles in that change process. The diagnostic formulation is one of the four components of a case conceptualization. It is basically an appraisal of the client's presentation, participation, and patterns. And it describes the client's situation and answers the questions what happened. The diagnostic formulation reflects both a diagnostic assessment and a clinical assessment. Um, so let's look at diagnostic assessment. A diagnostic assessment is focused assessment of the client and the current development context influencing the client. The purpose of this assessment is to discover answers to the question what uh, are some of the concerns for what are some of the client's concerns, distress, and diminished functioning for which the client seeks therapeutic assistance. A relatively complete diagnostic assessment interview can often be accomplished within the first 40 minutes of the initial session. However, this time frame necessary to complete such an evaluation may take considerably longer, depending on the client's previous history of treatment, their sense of ease and trust in the practitioner, and the language facilitated, like are there language barriers, and other psychological and cultural factors. The main focus of the diagnostic assessment is to gather information about the client that is relevant to the treatment process and outcomes. This includes data on the client's current problems, current functions, mental status, social, cultural, developmental, and medical history, and health behaviors, and particularly the expectations and resources the client brings to therapy. Since cultural factors such as cultural ideas, level of acculturation, and cultural explanatory models can influence the treatment process, it is imperative that these factors be identified. The true value of the diagnostic assessment cannot be underestimated. It aids the practitioner with immediate clinical considerations, and some of those considerations are: is the client's presentation primarily psychotic, non psychotic? Um, it is the client's presentation so acute and severe as to require immediate intervention, such as hospitalization. Essential. Um, Essentially, the diagnostic assessment is a phenological description and an intersectional assessment of the client in terms of diagnostic criteria. Uh, Diagnostic formulation. The diagnostic formulation is the descriptive appraisal of the client's presentation and participants, uh, and reflects the client's patterns. It answers the what happened question. It is phenomenological description of a cross-sectional assessment of the client's unique situation and pattern. This information is usually based on both the diagnostic assessment and the clinical assessment. Key elements of the diagnostic formulation, like I said before, are the presentation, the participant, and the pattern. So the presentation is the presenting problem and characteristic response to precipitants. The precipitants are triggers that activate the pattern resulting in the presenting problem. And the pattern maladaptive is inflexible, ineffective manner of perceiving, thinking, and acting. Okay, so it's like that's the best way I can explain it. So like when we come back, we're going to give examples of some of the treatment plans that are out there and how to actually formulate a diagnostic assessment. So let's look at a, um, a brief assessment that is done for a suicide assessment and just kind of go over some of the things that is looked upon.
So, Miss Rand, have you ever had any suicidal thoughts? And can you tell me about that? There's been a few times that I've thought about overdosing. And did you think about what you would overdose with?
I guess just prescription drugs.
Uh-huh. Did you have any of these prescription drugs at home?
No, not really.
Okay. Did you think about how exactly how you would get the prescription?
No.
Like any prescription drugs of anybody you know or live with?
No.
So had you picked out a time or a place to try to do this?
No.
Okay. And how long ago was that?
Say maybe a month.
Maybe a month or two. Okay. And have you thought of any other ways of harming or killing yourself?
Yeah.
Yeah. What? How was that?
I don't know. I got in my car last week.
Uh-huh.
And I started to drive, and I thought about driving into the other lane.
Uh-huh.
But then someone honked, and I got back in my lane, and I totally forgot about it.
And you forgot about it. Uh-huh.
Yeah.
Did you just do that once or more than that?
No, just once.
Just once. And were you pretty close to hitting the car, or was it far off?
Pretty far.
Pretty far off.
Mm-hmm.
Was that scary to you?
Yeah.
So did you have any more thoughts of maybe doing that?
Not after that, no.
No. And that was about a week ago. Okay. Any other thoughts about how to kill yourself or wanting to die? Any other thoughts?
Yeah.
Tell me about that.
My brother's a hunter
Uh-huh.
and he owns a gun.
Okay. So did you think about shooting yourself?
Yeah.
Yeah. Did you have access to your brother?
Notice in a diagnostic assessment of suicide, first you find out if they ever contemplated suicide. Then once you find that out, then you start probing and trying to see if they had a plan, how feasible is that plan, what, you know, if they have easy access to do these types of things. So if you notice, he started off with the overdosing and found out that she really didn't have the drugs. Now she have the possibility of driving into another lane. How often has she thought about that? When was the last time she thought about that? The whole concept of a weapon and our brothers are hunters and now she had access to guns. So it's like now he's going to start probing on that concord.
Just gun?
Yeah.
Mm-hmm. Did you get a hold of his gun or anything
No.
like that? Uh-huh. So, had you made a plan like when you would shoot yourself?
Yeah.
Yeah. When was that?
Like, I don't know, like 4 days, 4 hours.
4 days and 4 hours ago?
Yeah.
Uh-huh. So you had picked out a time. Did you pick out a place?
Yeah.
Yeah. Where did you pick?
I was thinking about doing it in my shower.
In your shower.
Mm-hmm.
Why in your shower?
Well, the shower water soothes me.
Uh-huh. So you're going to turn on the shower and maybe shoot yourself in the shower?
Yeah.
Now, did you have the gun out?
Yeah.
Oh, so you did have it. And did you have bullets for the gun?
Yeah.
How did you get the bullets?
I went down to the corner store called Huggins.
So you made plans ahead of time and went and got the bullets?
Mm-hmm.
So as you saw in that example, that's how you do a diagnostic interview. So the next thing you would do is do a safety plan, and then after that you'll do a treatment plan, we will discuss later on. All right. So um, we will be back in the next episode and talking more detailed about treatment plans.